Many OET candidates ask me what's the difference between a referral letter and a transfer or a discharge letter. In OET letters, there are two main categories. One is referral letter and the other one is transfer letter or discharge letter. Essentially the same. The structure will be the same. The only major difference will be what will be your focus. In OET referral letters, your focus is on signs and symptoms of the disease. In referral letters, you refer a patient to a specialist because you can't do something and a specialist can do. That's why you are referring the patient to a specialist. For example, there is a patient with some tummy related problem. For example, he's having intermittent diarrhea along with constipation, and you are suspecting cancer and you are referring this patient for colonoscopy. Now you know that you cannot do colonoscopy. You are not a specialist, you are not a gastroenterologist. That is why you are referring this patient to gastroenterologist. Now the most important thing in that letter, in that referral letter, will be patient's signs and symptoms. What are the symptoms and what are the signs? You need to convince the gastroenterologist that this patient is a suspected diagnosis of cancer. That is why this patient needs colonoscopy or OGD or whatever. So your main focus in referral letter will be on signs and symptoms of the disease. But in transfer letter or in discharge letter, the main focus changes because patient was already in the hospital. You have already managed the condition, a disease. So you don't need to mention signs and symptoms in detail. For example, a patient came in with bowel cancer, you performed surgery and now patient is fine. Now you need to transfer this patient to another hospital just because that hospital is near where he lives. So now your main focus will not be on signs and symptoms of the cancer. Why? Because you have already managed the cancer. Now your main focus will be what is the future plan, what is the management plan next. Like when he will need a follow-up, at what time will he need a follow-up, if there are stitches after the operation, when the stitches need to come out. So all this kind of thing is the main focus of your transfer letter.